So what are the 12 mistakes you're probably making in the OET speaking test? Here's a speaking role play that we're going to use for our example, and we are going to analyze the mistakes based on this card. So here the setting is a private clinic. You're talking to a 35-year-old woman who has recurrent UTIs. She believes the recurrent UTIs come from her lifestyle, hiking, gym, coffee, and has come to you to inquire about surgical management of UTI as she's fed up with constant UTIs that disturb her lifestyle and daily activities. Now, the three tasks are collect information on patients' habits so as to determine the cause of the UTI, reassure the patient that hydration and good hygiene are sufficient to avoid future UTIs, and surgery is ill advised. The last task, encourage the patient to improve her hygiene and check in a review if this brings benefits. The surgery can be discussed if there are no improvements. So, what is the first mistake that candidates normally make? Not asking anything to the interlocutor. During the 3-minute preparation, you're going to read the card, analyze the information, take a look at the task, see which questions you're going to ask the patient, but you can also interact a little bit with the interlocutor. The questions that you ask during the 3-minute preparation, they are not graded. You could ask, for example, how may I call you during the role play? What is your child's name in case the patient is a child? If you're not so sure about the meaning of a word, if you're not so sure about the pronunciation of a word, these kinds of questions are okay for you to ask the interlocutor. Now, what is the second mistake that many candidates make? Forgetting to ask the patient's name. You have two different opportunities to ask the patient's name. You can ask during the 3-minute preparation. For example, you could ask the interlocutor, how may I call you during the role play? Or in the beginning of the task, right after you introduce yourself. For example, hi, my name is Dr. Yemi. Welcome to our clinic. May I confirm your name, please? Of course, here you have to pay attention because sometimes you have to know the name of the patient beforehand. So you start the conversation in a more natural way. For example, hi Susan, my name is Dr. Yemi. Welcome to our clinic. I can see from my notes that you're suffering from recurrent urinary tract infections. What can I do for you today? That's why it's very important to use the name of the patient during the conversation. If you ask the name of the child, which is okay, remember that you are talking about the child, but you're only talking to the parent. Never ask questions or interact with the child because the interlocutor will only play the role of the parent. Now, the third mistake that is very common is not introducing yourself. Of course, there will be moments that you won't need to introduce yourself. For example, if it is a review appointment, a return appointment, if you're bringing in the results of the exams, right? In this case, you could simply say, hi, John, welcome back. I have the results of your exams and I would like to discuss them with you. So the patient already knows you, so it doesn't make sense for you to introduce yourself. But on this card, for example, we have no information whether she's already a patient of yours or not. So it would be nice to introduce yourself. Hi, Susan. Welcome to our clinic. My name is Dr. Yemi, and I'll be your GP today. What can I do for you, for example? The mistake number 4 is connected to number 3, which is you introduce yourself when you don't have to. For example, if you are discussing the details of discharge with the patient, you already treated her or him. Now you're only talk to him about the discharge. For example, hi John, I'm here to talk to you about the details of your discharge. How are you feeling right now? Of course, this is another card, right? It's not the same one that we are using as an example. So always be careful to the doctor part to see which information they are giving you about the patient. Mistake number 5 is something that is very important when you're not using the verbs from the tasks. In this case, task number one, you're going to collect information. So you're going to use a variety of verbs in your questions. For example, what do you do on a regular day? How much water do you drink? What time do you normally take a shower? Which is fine. But on task two, for example, you have the word reassure. Many times candidates simply don't use this word. They try to look for a synonym. No, if the word is there, use it. Well, Susan, I would like to reassure you that hydration and good hygiene are sufficient to avoid future UTIs, and surgery is ill advised. The same thing for task number three. We have there the verbs encourage and check. Susan, I would like to encourage you to improve your hygiene and your hydration for at least 30 days. Then I would like to check with you in a review if these changes brought you any benefits. That's it. You don't have to paraphrase. No, use the verbs, use the words from the tasks, but of course, make it natural. If you're enjoying this video so far, make sure you subscribe to our YouTube channel, like this video, and write in the comments below what is the next roleplay card that you would like to see in one of our videos. Mistake number six is something that happens quite often and it makes people get a score of 340, 330, or even lower, which is using compound questions. For example, on task number one, you're collecting information. So if you ask a question like this, could you tell me what you do on a regular day? For example, do you go to the gym? Do you go to work? How much water do you drink? What is your diet like? Okay, too many questions at once. These are compound questions. On the speaking rubrics of the OET test, it's clearly stated that you must not use compound questions. If you use them, you will fail. So ask one question, wait for the patient's answer, and then ask the following question. For example, so Susan, could you tell me what you do on a regular day? Wait for her answer. After her answer, you can ask another question. Okay, and how much water do you drink a day? Wait for her answer before you ask the next question. Now, asking questions is an important part of the OT speaking role plays, but mistake number seven is directly connected to that when we ask too many questions. In here, task number one is asking us to collect information. So on task one, we can ask as many questions as we need to understand what the patient is doing wrong on her routine. But on task two, we are only reassuring. No need to ask questions. Also, many times I see some candidates asking the patient questions like this. Is it okay if I explain to you what UTI is? No, you're not asking permission for the patient to explain anything. You're going to explain him. So, a urinary tract infection is this, and that. Is it clear? Of course, not on this task, because here we have no task asking us to explain UTI. But what I'm trying to tell you is only ask questions when they are needed. Now, since you're asking questions to the patient, it's very important to pay attention to what he or she is telling you. And that's why mistake number eight happens a lot when you're not paying attention to what the patient tells you. For example, after you ask the patient what brought you here today, she tells you, well, I have been suffering from urinary infections for 12 months. And then right after on task one or two, you ask, so how long have you been suffering from urinary tract infections? The patient has just told you that information, so this question is completely unnecessary. Pay attention to the information that the patient is telling you and use it in the conversation in a meaningful way. For example, you told me that you have been suffering from urinary infections for 12 months. Is that right? This is okay because you're just confirming the information that the patient told you. But be careful not to overdo it as well because it will not sound natural. Now, question number nine happens quite often when you're not paying attention to what the patient asks you. So, in this case, she could ask, okay, how about the surgery? Then you have to answer this question, right? Maybe you're not so familiar with surgeries, but you have to answer the patient's question. You could say something like, well, Susan, we have a protocol here at the clinic that we can only send a patient to surgery in more serious cases, in more severe cases. In your case, first we have to try some lifestyle changes about your hydration and hygiene. After 30 days, if you don't see any benefits, then we might be discussing surgery again. That's it, short and simple. Mistake number 10, when you ask the patient a question or when you finish a task and simply there is a silent moment. So you ask the question, the patient gave you an answer, and you're just waiting for something else. Do not wait for the interlocutor. Do not wait for the patient. As a candidate on the day of the OET speaking test, you are in control of the conversation. So you ask the questions clearly and politely, wait for the answer. If you see that there is nothing else to the answer, move on to the next task. Do not waste your time by thinking, oh, I was waiting, I was expecting the interlocutor to say something. No, if he or she didn't tell you anything, move on to the next task because later on the examiner will be listening to your conversation and thinking, why was there a silent moment? What was the candidate waiting for, right? Mistake number 11 is very important when you're not having a conclusion of the conversation. For example, you finish task number 3 and you simply stop speaking. If the interlocutor interrupts you and tells you this is the end of the speaking role play, okay, in this case, you stop speaking because you have reached the 5 minutes. But if he or she doesn't tell you that, it means that you still have some time. So it's always nice to have a short conclusion. For example, you finish task number 3. So, Susan, in this leaflet here, you have more information about urinary tract infections. In the back of it, you have the clinic's phone number. And in case you have any questions, feel free to contact us. Have a great day, and I will see you in our next appointment. That's it. Short, simple. The last mistake seems obvious, but here is where many candidates fail on the OET speaking test. It is when you make grammar mistakes in the questions. A very common mistake is using different verb tenses, incorrect verb tenses. For example, in another situation, not this card about urinary infection, but you can ask, for example, did you take any medication? No, it should be, have you taken any medication? Right? And even some simple mistakes sometimes because on the day of the test you're nervous, you're under stress, right? You are under a lot of pressure, and you make some silly mistake like what does you do, for example. This would be terrible for your score on the OET speaking test. That's it for today. Thank you so much for watching our video. Remember to subscribe to our YouTube channel, like this video, share it with everyone you know, and also write in the comments below what was your favorite part of this video. Have a great day, and I will see you next week.